What's up, you guys? I'm your host, Zach Main, here at the Cuckoo Cranium, and today we are going to be discussing about cranial nerve 8, otherwise known as the vestibular cochlear nerve. So when we think about cranial nerve 8, what comes to mind?
Well, gee, Zach, I don't know. It sounds like two parts.
That's right, young man. There are two parts, the vestibular fibers and the cochlear fibers. These fibers are purely sensory function, okay? And when we talk about the vestibular and cochlear portions of the vestibular cochlear nerve, they are functionally discrete. So they originate from different nuclei in the brain. So with the vestibular component, it arises from the vestibular nuclei complex in the pons and the medulla, whereas the cochlear component arises from the ventral and dorsal cochlear nuclei, which is situated in the inferior cerebellar peduncle. So to get in depth with the vestibular cochlear nerve itself, so the nerve emerges from the brain at the cerebellopontine angle and exits the cranium via the internal acoustic meatus of the temporal bone. With the distal aspect of the internal acoustic meatus, the vestibular cochlear nerve splits, forming the vestibular nerve and the cochlear nerve. The vestibular nerve innervates the vestibular system of the inner ear, which is responsible for detecting balance. The cochlear nerve travels to the cochlea of the inner ear, forming the spiral ganglia, which serve the sense of hearing. So, as we dive into the cochlear portion of the nerve, we want to reference that the cochlea detects the magnitude and frequency of sound waves. The inner hair cells of the organ of Corti activate ion channels in response to the vibration of the basilar membrane. Action potentials travel from the spiral ganglia, which house the cell bodies of neurons of the cochlear nerve. When we talk about the magnitude of sound determines how much the membrane vibrates and thereby how often the action potentials are triggered. The louder the sounds, or louder sounds cause the membrane to vibrate more, resulting in action potentials being transmitted from the spiral ganglia more often, and vice versa. The frequency of the sound is coded by the position of the activated inner hair cells along with the basilar membrane. So when we get into the vestibular side of the nerve, the vestibular apparatus senses changes in the position of the head in relation to gravity. The vestibular hair cells are located on the otolith organs, or known as the utricle or the saccule, where they detect linear movements of the head, as well as the three semicircular canals, where they detect rotational movements of the head. The cell bodies of the vestibular nerve are located in the vestibular ganglion, which is housed in the outer part of the internal acoustic meatus. When determining if you have a vestibular problem or a cochlear problem, there are certain tests that you can do that can help prove your diagnosis is accurate. With the vestibular side of things, you can do the pass pointing test, or you can do the vestibulo-ocular reflex. Just a couple of examples. Or with the cochlear side, you can do the Wren and Weber test. So the first thing I'm going to talk about is the Wren test. I have a piece of chapstick here, but pretend this is a tuning fork. So with the tuning fork, you are going to want to first hit it until it makes a sound. You're going to put it up to the ear. They should be able to hear the sound. Once the tuning fork stops making the sound, you want to move it 1 inch towards the ear. They should be able to still hear the vibration of the tuning fork. If they don't, there is some type of cochlear instability that we must discuss. When you want to do it, you'll want to do it bilaterally. So both sides, you'll want to hit it and then put it 1 inch once it stops making noise. If they don't hear it on one side and they hear it on the other side, and that means the side they didn't hear it on is the part with the instability. So the next test that I want to go over is going to be the Weber test. With the Weber test, you're going to take your same tuning fork and you're going to hit it, making a noise, and you're going to put it above their head. So when it's above their head, they should be able to hear the sound equally through both ears. If they can't hear both sounds equally through the ear, then they have it's called sensorineural hearing loss. So there's some type of cochlear lesion with that, and you probably need more further testing if that was an accurate diagnosis. So the next tests we're going to get into are going to be the vestibular tests. These tests are going to determine types of balance or coordination type deals. With the first test I'm going to explain is the pass pointing test. This test is to test for coordination or cognitive function. The tissue being tested is going to be the cerebellum of the brain. So when we get started, you're going to want, if you're the examiner, you're going to want to have your arms extended with your fingers 6 inches apart from each other, your index fingers. The examinee then will extend his arms over his head and try to touch your fingertips. And then once he does that, you'll want to repeat it, but with the eyes closed. If he cannot touch the fingertips with his eyes closed, that is a sign, that is a positive test. And this could interpret either a concussion, you could have vestibular problems, or it may indicate an injury of the cerebellum itself. So the next test and the final test that we're going to get in today is going to be the vestibulo-ocular reflex test, also known as the head impulse test. This test involves the activation of the motor neurons that innervate the extraocular muscles. The function of the reflex is to maintain the orientation of the eyes in space during head movements so that the visual image remains stable on the retina. This is accomplished by the generation of eye movements that are equal and opposite to head movements. So how to actually do the test, you will want to have the patient focus on one point. Usually it is the examiner's eyes. While the examiner is holding the head of the patient, the examiner will also want to look in the patient's eyes. After that, you'll want to move the head left and right, also up and down and diagonally. These are rapid movements to get the VOR reflex to actually activate. If the eye goes with the head when you're rapidly turning it and then tries to move back and to look into your eyes, that is a positive sign of peripheral vestibular dysfunction. So we're at the end of the video, and I just want to bring up a few more pathologies for the vestibular cochlear nerve that you'll want to look out for. Those could be concussions, tinnitus. You could be looking at vestibular schwannoma. You could be looking at benign paroxysmal positional vertigo, autoimmune inner ear disease, and you could be looking at bilateral vestibular hypofunction as well. That's all here at the Cuckoo Cranium, and you all have a great day of learning.